my name's Nick, and today we're going to do hand washing. First of all, I'm going to look at my hands, make sure there's no abrasions or cuts. Then I'm going to check my nails, make sure they're appropriate length. And then I'm going to pull my watch up, make sure it's not in the way. And then I'm going to begin my hand washing. I'm going to make sure it's lukewarm water, not too hot, not too cold. And then I'm going to put about a teaspoon of soap in my hand. And I'm going to rub it down, make sure it's pointing down. And then I'm going to go in between the fingers, get the nails. Then I'm going to make sure the thumb's all good. Make sure it's all good for 20 to 30 seconds. Then I'm going to rinse. And then I'm going to grab some paper towels. I'm not going to be touching anything. I'm going to dry my hands off. Make sure they're all dry. And then if I had a handle there, I would use another paper towel and then turn the water off. And if it was alcohol-based rub, I would use it. First of all, I would check for my abrasions and cuts, pull the wristwatch up, use about a teaspoon, and then I would rub for 20 to 30 seconds, and until it's dry, I can start my process. Now, I'm going to be starting my PPE. I'm back, and today, we're going to be putting our PPE on. First, we're going to start off with our gown, because we're doing contact precaution and the other one. Okay, now we're gonna tie the in the back. Then we're gonna tie in the front. Droplet. Then we're gonna put our mask on. We're gonna pinch it, make sure it's good. Then we're gonna put our goggles on. Okay, and then we're gonna put our gloves on. I'm gonna start with my dominant hand. Make sure it's over the wrist thing. Then we're going to go non-dominant. Over that. And now we're ready. Knock, knock. Hello, my name's Nick. I'm going to be your nurse today. I'm going to close the door. And today, can I get your name and your date of birth as well? Okay, perfect. Today we're going to be putting you in your side ladder position, so we're just going to lay you on your side. And we're going to have my associate here help me put you on the side so you're more comfortable. We're going to take the blanket off. Of course, he has protective PPE on, as you can see. First, we're going to put him on the side, so we're both going to help and put him on the side. Here we go. Okay. Now I'm going to grab the appropriate pillows. Putting one on behind him. And then I'm going to put one between his legs. There you go, sir. There we go. And now this is the correct position. Also, I'm going to put one in on his head and neck just to make sure it's stable. There we go. And now we're going to leave the room. Open the door, of course. Close the door. And now I'm in a safe area outside of the door. I'm going to take my PPE off by first grabbing this, pulling it off. Then I'm going to take this, take my gloves off too, because this is sterile on this side. And then I'm just going to throw this away. Then I'm going to take my goggles off. Throw this away as well. I'm going to wash my hands again, and then I'm going to take my mask off. Then throw that away as well. And then we're done. So, forgot to raise the bed, but should have been hip height.